In 2005, my family moved to this farmhouse, and we started noticing we were having some health issues. The farm originally was 124 acres, and we purchased 20 acres from the farmer. And located next to the farm is an old 40-year-old hog facility that housed 400 hogs.
How far is that away from your house?
It's about 250 feet away from our home. And we started noticing some health effects. When I was little, I grew up next to a farm that housed hogs. And they were free-range hogs, and we never had any problems with them spreading manure or smelling the manure from the hogs. And when we moved here, we noticed it was a constant 24/7. And we really didn't understand, this type of facility until we moved further along in living here. So once we moved in, we started noticing irritability and anger issues, which was not normal for our family. And then we started to develop respiratory problems, tightness of chest, shortness of breath, bloody noses. One time my son had a bloody ear during breakfast. Feeling off balance, dizzy. And so, we would go to the doctors, and the doctors, couldn't explain it or would kind of just shuffle it off. And they progressively started to get worse, and we started having neurological problems, clearing our throat, coughing, tics. And we didn't find out till about 2000. Well, the first problem we had was they were spraying every 3 weeks by our well, about 100 feet from our well. And I wasn't sure why they kept spraying in the same spot, because they have a lot of acreage, the farmer. And the farmer decided at that point he wanted to go from 400 hogs to 4,800 hogs. And I was concerned because, we were already having issues from the off-gassing from the smaller facility from just 400. And the neighbors started to throw a fit because they didn't want that many hogs in the area, and they were concerned, and they started voicing their concerns to me about high nitrates and coliform in the water. And at that point we had been in the house over a year, I guess, and we started having some gastrointestinal problems, like not being able to go to the bathroom, pains in our stomach. One child was having diarrhea all the time. Couldn't figure out what was going on. And so finally my neighbor at the end of the driveway, informed me more about the nitrates and coliform, and I decided to have our water tested. Well, it turned out our nitrates doubled from the normal limit to 22.22, and we were found to have coliform in our water.
And unpotable water is
non-potable.
At 10.
Yeah.
So your nitrates were
22.22. And then my daughter was tested and found to have H. pylori bacteria. We had to have her get an endoscope. And not realizing at this point, I later found out that I was probably infected with hepatitis E virus during that period of time, which doctors didn't know to test for. I had all the symptoms of it, was sick for quite a few months, went through having radioactive scans on my gallbladder and other tests that came up. They couldn't figure out what was going on, why I was having the pains in my stomach. And hepatitis E is, I said that right?
Yeah.
Hepatitis E is specific to hogs. 95% of hogs carry this virus. And so I'm not sure whether I got it from them spraying the manure so close to our home and I inhaled it, or if it was in our water. So then we thought the water issues were the worst of our problems. They finally stopped spraying near our well. And then in 2009, in January, the farmer was having issues with his pipes freezing. So he sealed the barn with plastic tarp, and I thought, the hogs are going to die because there's no air coming in. There was absolutely no area where air could come into the barn. And sure enough, the next day, hogs started dying. And they were in there for about an hour and a half pulling hogs out. So I talked to Maria, who has a friend who's an engineer, and she said, the hogs are dying from asphyxiation from hydrogen sulfide poisoning. And I was like, well, what's hydrogen sulfide? So I started looking it up, and I realized that my family was having all the symptoms that hog confinement workers have from the off-gassing of hydrogen sulfide. So I was concerned for the farmers being in there for such long periods of time, and called the EP on a Friday. And then Monday, the hogs were picked up out of the barn, and I had a note on the door saying the building was closed for repairs. And it turns out hydrogen sulfide is a neurotoxin. It has the toxicity of cyanide. And I calculated there's 36,000 gallons of manure that are located in the manure pit 250 feet from our room, my daughter's bedroom. So we realized that the off-gassing was a serious problem, and I guess DEP also, I think they urged the farmer to shut the building down because they knew that they were permitted for a larger facility. And as soon as the hogs left and the manure was taken out of the building, a lot of our neurological problems dropped off, and the tightness of chest, the dizziness, everything seemed to calm down once, that we were left with the damage. And when you go to the doctors and you explain to them your issues and that you're next to factory farms and the off-gassing, they really don't understand the whole toxicology of what families next to these type of facilities are going through. I took my children to a couple specialists, and they were diagnosed with reactive airway dysfunction. It's called RAS, which is a reaction that your body's having to the gases.
Now, you talked about Christopher with the gastrointestinal. How many times did your daughter Mulaney, how many times did she go to the school nurse?
In 2009, there was about 40 calls from the nurses from September to when the facility was shut down, and they were increasing. I would take her up to the bus stop, and the gases, were filling the air. And one time, she felt like she was going to pass out on the bus, and she got to school, and her blood pressure, I believe, was low, and she was having neurological pains in every part of her body, in her hands, in her feet, in her legs, in her lungs, in her kidneys, in her brain, in her eye. I had to rush her to the emergency eye doctor, and then I had to take her to a neurological ophthalmologist because her eyesight was affected, and anything that the ophthalmologist could offer didn't help. So she had to go to a neuro-ophthalmologist who said we needed to speak to a toxicologist. And then the one day that she had problems on the school bus, we took her to the emergency room, and they did some tests on her, and the people in the emergency room said, you're probably dealing with some kind of environmental toxin.
So now, I know you had, well, first, you guys had a lot of issues here that I know DEP was not responsive to.
No.
As far as the disposal of the mortality.
Yeah. Mm-hmm.
They would just leave them.
Yeah, at one point, we saw about 30 hogs that had died in the facility, larger hogs, and they just threw them next to the building, which they decomposed. We had vultures and foxes, and they were just swarming the area, eating the carcass, and the rain would come off the hill and wash the parts down into our stream, which feeds into our pond. And our children were playing in the pond, and the horses were drinking out of it. And I had to, I stopped them from playing around in the pond area because, it was just, I didn't realize how dangerous it can be having, hogs produce a lot of bacterial and viral things. And we didn't realize that they were inappropriately disposing of them at, that point. We didn't understand. And so we did complain, and they gave a fight. The next batch that died, after they were told by DEP they had to bury the pigs 2 feet underground, I think 25 feet from or 40 feet from a water source. and they had to have lime on them. The farmer had more dead hogs and laid them behind their farm, behind the building, and let them rot and didn't dispose of them properly again. And now I'm hearing the farmer now has 2,400 hogs, and he just recently had 100 hogs die, and he threw them out on the field and sprayed manure over them. And when you call DEP, they don't respond. Like my neighbor up here, when I told my neighbor about her well, I said they're spraying within 100 feet of your well. They should not be spraying that close. I'm thinking they're probably about 25, maybe no more than 35 to 50 feet. It's very close to their well, and
they have children as well.
6 times more manure than what was sprayed up by my well. And we had another neighbor who was behind our house. When they stopped spraying manure by our home, they started spraying by his home, and his son all of a sudden turns up with H. pylori bacteria. And I also warned them about the hepatitis E, because people now that are living next to these factory farms are being infected with hepatitis E.
Now, you had problems with, I believe, lesions on your brain.
Yes.
Mark had, I guess, and you as well, problems with MRSA.
Yes. When I started researching, after the barn was shut down, I was really concerned because we were having memory issues. And I think one weekend I got, luckily the family wasn't there, but I think because I've been here longer, I'm in the home more and in the environment more. One weekend I came home and I was in bed for 2 days I felt like I had a clamp on the front part of my brain. It hurt so bad. And I was like, my arms were pulling up, and I was convulsing, and my legs were jolting and convulsing. And I wasn't really capable of telling anybody because I was pretty out of it. So I laid in bed for 2 days, and I was able to, get to the bathroom, take a Tylenol, but I couldn't understand, why I was pulling up and convulsing. And, that week after, I thought on the Sunday that I said, if I'm still sick in my head on Sunday, I need to go to the hospital. And Sunday came around, and I started noticing, I started relaxing a little bit, and I wasn't having the neurological pains, the pulling up and jolting, and I was able to get out of bed, and the headache seemed to release. And that whole week, felt like I had white fog in my brain. I felt like I had I felt like I was an Alzheimer's patient. I was switching words. I said to my son, what kind of snacks do you want in your lunch, is what I wanted to say. Did I say that right?
Yeah.
I said, what color socks do you want in your lunch? And I meant to say, what kind of snacks do you want in your lunch? I had no idea. And I was putting things, the butter in the drawer where the sandwich bags are, and couldn't hold a conversation with people because I couldn't recall information. And so I had severe respiratory problems, could not breathe. And, I come to find out that, how serious, these gases are. And, we had been exposed to them for years on low and high parts per million. And I think that weekend I had just had about too much from them closing the building up and then dispersing the gas. It takes about 24 to 36 hours for it to dissipate, and I think I just may have gotten too much. And so after I was thinking a little bit more clearer, I realized we needed to go have some MRIs done on our brains, and mine turned out to be the worst. I had what appeared to be demyelinating disorder, ischemic changes, and I had a large area in my sphenoid sinus that they said was opacified, which had some kind of infection in it.
So basically, for people who will not know these terminology, something was eating away at the bone.
Yes,
in your nose.
I had some kind of infection in my sphenoid sinus, which is the back sinus, which is very rare for anyone to get an infection in that area. Usually you're immune compromised. You know, I had never seen, you know, no doctor ever told me I had an immune problem. I later found out that hydrogen sulfide can lower your immune system, makes you more susceptible to things. So somehow along the line, I wound up picking up an infection in that part of my sinuses. I went to an ENT on my own, and he took me in right away that week for surgery. And at that point, I had researched it a little bit, and I realized it's very rare to get staph in that area. Usually it's fungal. And, you know, I know that with the manure, when the manure dries, it carries mold and funguses on the manure. It dries off, and it, you know, it can blow. There's actually even a new strain of MRSA, ST398, that the hogs carry that can pick up and blow through the manure dust into your homes, you know, onto your cars. So anyway, I had a surgery done to clean it out, and I asked the doctor to check to make sure what it was, and it turned out to be fungal. The actual fungus was going into my eye, almost caused blindness in my right eye. Came out of the surgery, and for about a year, the doctor couldn't get it to clear up. You know, I did antibiotic nasal washes, steroids, nothing helped. A year later, he took me in for another surgery, and at this point, I felt like, you know, I almost had meningitis. I was having, you know, severe pain in my jaw, in my ear, up into the back of my spine. And so, you know, it just, they're not, you know, they're very unclean, healthy environments, and a lot of people living near them don't realize how dangerous the health effects are.
Now, I understand Mark had to go to, your husband had to go to an infectious disease doctor.
Yes, Mark had, all of a sudden he went away and he crossed his legs, and when he uncrossed his legs, he couldn't stand on his leg. So he had to fly home, took him for, you know, all kinds of tests, you know, x-rays and MRIs and all that stuff on his hip. They took him in for hip surgery, and the hip surgeon was like, I've never seen anything like it. He had his gluteus medius, I believe it was, it attaches to your hip. It had turned to mush. And so the doctor had to cut off the sick area, and he had to then attach bolts to his hip and then reattach the muscle.
And they were giving him very strong doses of antibiotics?
Yeah, well, he was fine after the surgery. They only had to cut 4 little holes, but then, you know, and I had warned the doctor ahead of time. I said, we're living in a very dirty area with these factory farms. So we have a chicken farm and a hog farm. And I said, just clean him really well. And so a couple weeks after the surgery, his one little incision just started oozing. It was red. Put him on antibiotics. Still wasn't getting any better. And then, you know, one day he calls me into the bathroom, and he's like, come here, you know, and he's got gray liquid just running out of his, you know, opening onto the floor, and there was a puddle on the floor. And at that point, then the doctor said, you need to come back in. So he cut his leg from here to here and cleaned him out, you know. Basically, I power washed you out and closed him up. And then he was still having seepage, and had to go in the week later, had to open him up again, clean him out again. And then it turned out that he had a MRSA infection, and it went into his bone. It had loosened the bolt that was holding his muscle, touching his molar, from the first surgery that he had, the little bolt, the MRSA had gathered around and gotten into his bone.
And for those that don't know what MRSA is an antibiotic-resistant staph infection, and it's flesh-eating. And I know that, well, you know, we've had rashes up around our house. I live up the street.
Yeah, a lot of people in the area.
You've also experienced that with the rashes.
Mm-hmm.
And right now, this beautiful farm that you and your husband put all the sweat equity into and rehabbing the house sits here because the doctor told you to move?
We had to leave the house because they're not only just before we had the 36,000 gallons of manure, now we have 6 times more.
And now when they were spreading, your symptoms were coming back
when we were spraying, I pulled the farmer out here and I said, the gases are coming into our house. We can't breathe. I'm starting to have memory problems again. He doesn't care. He just wanted to move the manure truck along because they're paying him by the hour. And so at that point, my husband and I had to make the decision because we thought, it wouldn't be, hopefully they'd be spraying elsewhere. But when you're dealing with 6 times more toxic material, we needed to decide to cut our losses. We just can't, destroy our health much more than what we've had. We're still recovering from, the 36,000 gallons that, we were exposed to for almost 6 years.
So now you are renting a house.
We stopped paying our mortgage. We're renting a home in order to be in a safe home.
Nobody wants to buy this place,
we've been very vocal to let other people know, and now other neighbors are having problems from the new facility. They sprayed a couple 100,000 gallons right before we left, and now, our other neighbors are starting to experience, what we were experiencing for 6 years, and we were vocal because we didn't want that for the community. Nobody wants to say, my child can't breathe, and they go to the doctor, and, well, their lungs sound fine. They're not trained in toxicological gases like this.
So basically, all your investment in this house is heading towards bankruptcy because nobody wants to purchase a property with bad wells.
We have the house up for sale, and we've disclosed the issues, and, it's been up for a long period of time, and so we're at the point now of possibly handing it back to the bank.
Well, I know it's hard for you to come out and talk about all this. I know you guys were here for years and put a lot of sweat equity into this property. A lot of memories here, and thank you for sharing your story. I hope others will learn.
I just want more people to understand the dangers of factory farming, and there's a lot to be learned with the toxicology of environments. I think we're going to start seeing more people speaking out about the health issues these factory farms are causing.
Thank you.